Why even have missing teeth replaced? Do you even need implants at all? And do I need all of my teeth? These are questions that people ask all the time on my website. And let's talk about everything here, just kind of as a whole. So, nature gave us 32 teeth, maybe 28 without our wisdom teeth. And they all supposed to lock in together, and one protects the other. When we lose one tooth or several teeth, your bite becomes out of balance. Even with just one tooth, your teeth begin to shift a bit and tilt, and maybe the jaw begins to hurt or cracks a bit when you open and close. And that even happens from losing one molar, like number 19 or number 30. Those are the lower first molars, which are commonly lost. So what happens is it perpetuates itself. One tooth lost puts extra pressure on the others, and then you subsequently lose another tooth. And let's say you lost two bottom teeth over here. Well, then your top teeth don't have anything to bite on, and they'll begin to drift downwards, looking for something to bite onto. So the whole bite begins to collapse. The smile kind of shifts sideways. And over time, as we lose more teeth or the full arch of teeth, then our face begins to collapse, right? So we lose facial support because we no longer have this hard bite that makes the muscles strong, this masseter, temporalis, all these muscles that keep our face toned. We really don't need them anymore. So basically, do we need our teeth? Of course we need our teeth. And do they all need to be replaced? Not necessarily all, but most do. Sometimes the second molars or the very, very last ones right in front of the wisdom teeth don't need to be replaced. But in general, most all of them do, whether it's by bridges or implants. There are many good options. Implants are the best because you don't have to grind down your adjacent teeth. And, it's a non-invasive procedure. It's really the most conservative way to replace a missing tooth. But if things are left for a long time, you'll see, your face will begin to collapse and shrink, like the old people have really small sunken in faces and wrinkled, and it looks like the distance from the nose to the chin begins to decrease and begins to shrink. That's called loss of vertical dimension. That's when things really worsen. All of that can be restored back. I mean, for some patients, I do, full mouth dental implants, the whole mouth all at once. I put teeth in the same day. Sometimes zygomatic dental implants, but people have severe bone loss, right? So the bone loss comes when you lose the tooth. So not just does your bite shift and does your face collapse, the gums shrink and the bone shrinks because there's no reason for them to be there anymore. If you didn't use your right arm for a month and put it in a cast, your right arm would begin to physically shrink. The muscle would atrophy because of it. What you don't use, you lose. And that is really something that is very important to understand, that that bone shrinkage, sure, it could be built back and we could do bone grafting and all that, but the reality is, the point is to avoid all of that. And really, most importantly, our missing teeth, they give us a sense of, self-worth and confidence and beauty. A lot of people replace their missing teeth or all of their teeth or their dentures because they just don't feel good about themselves anymore. They feel like they've lost something that really was a big part of them, and they've lost self-confidence, and maybe they're not dating anymore, or there's, the embarrassment of taking in and out teeth, or just not having an attractive smile. So having a nice smile that you can be proud of is so important for our emotional health, and not just our physical, having a tooth there. Sure, some of us just need teeth for chewing and don't show a lot of a smile, but our teeth, support our entire lower face and are really important to our well-being. I know it sounds like I'm off on a tangent, but most people make their decisions based on these emotions, not so much the technical aspect of replacing teeth. I can replace any tooth in the entire mouth or all the teeth at once. Certainly do your due diligence, have work with a provider that really cares about you and that's an expert in the field, and has a good reputation for long-term results, because we know that dental implants are not permanent. We've come to find out that our teeth are not permanent. I've cracked 3 of my own teeth before and have, crown or partial crown. So these things happen, to the best of us. So I really appreciate watching this video. It's kind of a follow-up to an older post that has always had a lot of questions. Please do some research on the website. There's a search feature. You can find just about everything on every topic here to help you make some good decisions. Thanks so much. I'm Dr. Ramsey Amin, BurbankDentalImplants.com. I'm in Burbank, California. Thanks so much. Take care. Bye-bye.